India's Prime Minister Narendra Modi has announced a credit guarantee scheme of $6.7 billion to strengthen the health infrastructure of the country. Modi made the announcement during his virtual interaction with doctors on National Doctors' Day.
नेशनल डॉक्टर्स डे की
Modi appreciated the efforts put by the doctors and health workers to fight the deadly COVID-19 pandemic that has infected over 30 million people in India. On Thursday, India reported 48,706 new COVID-19 cases in the last 24 hours. Indian drug maker Zydus Cadila says it has applied for emergency use approval of its 3-dose COVID-19 vaccine that showed efficacy of 66.6% in an interim study and could become the second homegrown shot if regulators consent. The company says it hopes to be producing 10 million doses a month by mid-August. Coronavirus infections have dropped from a devastating peak in April and May that had strained healthcare facilities. Experts have warned of a third wave, saying widespread vaccination is one of the best pandemic defenses. Approval for the shot would mean it would become the 5th vaccine authorized for use in the country.
For more on this story, we're now joined by Dr. Rajib Dasgupta, who's the chairperson of the Center for Social Medicine and Community Health at the Jawaharlal Nehru University in India. Thanks so much indeed for joining us and welcome to the program, Dr. Dasgupta.
Hello, Peter.
All right, let's start with National Doctors' Day. This comes at one of the most difficult times for the medical fraternity in India, especially with what we've just seen, this Delta variant. Has there been enough health professionals? And I guess it's been a really difficult and tough time for them working the hours that they've had to.
Yes, it's a solemn moment to pay homage to the doctors as well as many other paramedics and frontline workers who lost their lives in this last 2 waves of COVID. And today's Prime Minister's address did mention that, did pay homage to their memories. And in addition, the announcements that he made are essentially to boost up health infrastructure, particularly away from the 8 metropolitan cities in Tier 2, Tier 3 towns, and down to the rural areas where more investment is certainly necessary, as has been shown by the COVID experience.
All right, before we get into the COVID story, I know that social medicine is one of your areas of expertise. So this infrastructure build, are we able to say that there's still people perhaps who may even be losing their lives just because there aren't enough facilities near where they live?
There are 2 ways of looking at it. One, of course, is since 2005, the National Rural Health Mission and subsequently the National Health Mission has sought to make widespread architectural changes in the country's healthcare system, exactly to boost these weaknesses of having reliable, adequate healthcare available as close as possible, particularly in rural areas, in geographically challenged areas. However, that remains an unfinished agenda, and as the COVID experience has shown, that primary care, particularly in rural areas, continues to remain a challenge. And therefore, the Prime Minister's address has to be seen and understood in that context.
All right, let's talk about COVID-19, the Delta variant, which has now found its way around the world, first seen in India. And it was responsible for so much infection and loss of life in your country. Where is the country now at this point? Have you got over the worst? And is this something that you're starting to see light at the end of the tunnel?
Yes, the second wave has been a ferocious wave. The second wave, of course, is not attributable to the Delta variant only, the Alpha variant also played a role in some states, and in areas such as Delhi, multiple variants had been at play, and therefore it's been a ferocious second wave. And as we have seen, the number of cases as well as mortality has been very high. But now, of course, in most parts of the country, it's remarkably improved. Life is getting back to normal or as close to normal as possible as different sectors of economy are opening up, except, of course, education and leisure industries particularly. But all state governments are striving very hard to get back as much of the economy back in feet as possible.
Could South Africa have learned some lessons once we knew about the arrival of the Delta variant? Could we have learned something from how it played out in your country and what you did to manage it?
Well, in all honesty, the Delta variant also caught us unawares, or at least the scale of it. Though, as you said very rightly, that it was indeed identified pretty early. Some isolated cases in the last year and certainly by February in some parts of the country. But it spread very rapidly. In fact, it's certainly more transmissible than the Alpha variant, which was identified in UK first in 2020. And the fact that highly transmissible variants are dangerous, more so than variants which are more lethal, because it multiplies very rapidly, the number of cases that is. And as we have seen in the Indian experience, it completely overwhelms the existing healthcare system. And this could end up in mortality, as modeling shows, up to 8 to 9 times of the original variant, just because it's highly transmissible and it completely overwhelms the system, and not necessarily because it's more lethal. And that really is the lesson for all countries as the Delta variant continues to spread far and wide across the world. The WHO apprehends that this would become very shortly the dominant variant across the world. And the challenge lies in its very fast spread, and therefore how quickly health systems are able to respond to it and enhance capacity.
We'll talk about vaccinations just now because it is a mitigating factor, but are you worried about a third wave and what that might look like?
Well, there's a lot of talk about the third wave, but honestly, it's difficult to make an assessment without seroprevalence or serosurvey results available from the ground. And they say it in the context that about a fortnight ago, India decided to have district-level serosurveys, and the Indian Council of Medical Research will undertake that. And that really will give us an idea of the extent of spread that's already happened across the country, and therefore the possibility, if and when, of a third wave perhaps needs to be seen through that lens. And of course, the fact that vaccination is still proceeding, though not necessarily at the pace one would like, and the coverage of vaccination does remain uneven, either across rural and urban parts of the country or across age groups and so on.
Well, let's talk about vaccination. How is that coming along? And you are blessed in the sense that a lot of this vaccine is manufactured in your country.
Yes, that's certainly an advantage, as we have seen, both in terms of vaccine development as well as in production capacities, and therefore not having to import vaccines to the scale many countries are. Therefore, the vaccination, particularly in June, has been pretty comfortable, given that May was really a crunch month. However, there are states who are now reporting some unevenness in the vaccine supply that seems to have upset the pace at which they thought they would proceed. But as the central government projections go, the vaccine supply is expected to pick up constantly, both on account of enhanced production as well as introduction of newer vaccines.
All right, so in the coming months now, what are we starting to see? I mean, we look at Europe and America, North America, people have started gathering in crowds to sporting events, taking off their masks. Is this something that authorities are warning against, or are you starting to see that a little bit more in India?
The authorities are certainly overcautious about letting the guard down, perhaps, as far as the COVID-appropriate behavior goes, because ultimately that remains the mainstay till adequate vaccination coverage happens or definitive therapy becomes available. So no doubt COVID-appropriate behavior remains very central. However, what we also often do not recognize as sectors of economy, sectors of activity are going to open up is the extent to which indoor work environment is safe from the COVID point of view, because that involves ventilation, structural issues of workplaces, air conditioning systems, and so on. And that's something I believe we need to focus a lot more on, as it's such a vast country and an umpteen variety of indoor workplaces.
People's behavior has always been one of the issues. Here in South Africa, we certainly have been seeing it. And slowly but surely, some people get the message and others not so much. Has there been a shift, especially after the second wave in India?
Well, anecdotal evidence does suggest a shift. However, there is no denying that behavioral aspects are so central, and therefore a whole lot of investment needs to go into social and behavioral research and into communication content and strategy around those. And if there is one sterling example that we have in public health, including both our countries, is from the field of HIV/AIDS, where behavior, risk, and so on remain so central, and therefore how we address those in terms of communication and messaging is so crucial.
All right, perhaps a final question. I see that Indian drug maker, I think it's Zaidus Cadila, has applied for emergency approval for its 3-dose COVID-19 vaccine, and apparently it shows an efficacy of just over 66%. How much do you know about this one? And 3 doses is quite a lot, isn't it, given that a lot of people are struggling with the idea of 2 doses?
It's a DNA plasmid vaccine, and it's a platform or a technology that does offer a lot of promise in theoretical terms. It does have proven efficacy in vaccines that are used in the veterinary world. However, the DNA plasmid vaccine that Zaidus Cadila is developing and offering is under scrutiny currently of the drug regulator. What they are also presenting are 2 sets of data which they argue or seek to demonstrate are comparable. And these 2 sets of data are a 3-dose regimen versus a 2-dose regimen. And the understanding is that the claim is that both are equally efficacious, and therefore we may at this point see a 2-dose regimen and not necessarily the 3-dose regimen that was talked of originally. And further, they are promising to have a capacity up and going by mid-August to September of about 5 million doses per month, which they hope to augment to about 10 to 12 million doses per month by December, January.
Dr. Rajib Dasgupta, we'll leave it there. Thank you so much indeed for joining us, and Your insights always greatly appreciated. Thank you.
Thank you and good night.